Can cholesterol, smoking, and drinking kill your erections? A urologist explains. Are you dealing with weak or inconsistent erections? You've probably heard that diabetes is one of the big culprits, and that's true. But what if I told you that high cholesterol, smoking, and drinking might be silently sabotaging your sex life too? These three factors damage your blood vessels, nerves, and hormone balance, all of which are essential for healthy erections. And the scariest part? They often do it gradually, so you might not notice the problem until it's much harder to fix. In today's video, we'll break down how cholesterol, cigarettes, and alcohol damage erections, the science and mechanisms behind it, what a urologist recommends to reverse or prevent the damage, and powerful treatment options backed by research. Let's dive in, because your performance is worth protecting. Part 1. How erections work, a quick recap. Before we talk about damage, let's quickly recap what's supposed to happen when everything works perfectly. Erections are primarily a vascular event. The sequence goes like this. Brain stimulation, erotic thoughts, touch, or visual cues send nerve signals to the penis. Nitric oxide release. Nerve endings release nitric oxide, which relaxes the smooth muscles in penile arteries. Blood vessel dilation. This relaxation lets blood flow rapidly into the corpora cavernosa, the two spongy chambers inside the penis. Venous trapping. As the chambers fill, surrounding veins are compressed, trapping blood inside and keeping the erection firm. This whole process relies on three main pillars: healthy blood vessels to carry and trap the blood, proper nerve function to trigger the sequence, hormonal and psychological balance to maintain desire and performance. If you damage any of these pillars, you interfere with the system, and that's exactly what cholesterol, smoking, and alcohol can do. Part 2. High cholesterol and ED. What is high cholesterol? Cholesterol itself isn't evil. In fact, it's essential for making hormones like testosterone. But too much LDL cholesterol can cause atherosclerosis, the hardening and narrowing of arteries. Mechanisms of damage. Atherosclerosis of penile arteries. These arteries are just 1 to 2 millimeters in diameter. That's smaller than the arteries supplying your heart, so they're often the first to get clogged. Reduced nitric oxide production. High cholesterol inflames the endothelium, the artery's inner lining, reducing its ability to release nitric oxide. Endothelial dysfunction. Once the lining is damaged, it can't dilate properly. Hormonal imbalance. Severe lipid problems can even disrupt testosterone production in the testes. Bar chart study spotlight. The Journal of Sexual Medicine, 2020, found that men with high cholesterol have a 1.8 times higher risk of erectile dysfunction compared to men with healthy levels. Part 3. Smoking and erectile dysfunction. Smoking doesn't just damage your lungs, it's one of the most direct ways to damage penile blood flow. Mechanisms of damage. Nicotine-induced vasoconstriction. Nicotine causes your arteries to temporarily narrow, cutting off blood supply. Oxidative stress. The chemicals in cigarette smoke damage the endothelium, accelerating atherosclerosis. Nerve damage. Smoking affects nerve endings and can make the penis less sensitive. Testosterone drop. Nicotine and toxins can harm the Leydig cells in the testes that produce testosterone. Bar chart fact. According to Andrology, 2018, smoking increases the risk of erectile dysfunction by over 50%, even in younger men. And yes, secondhand smoke can also affect erection quality. Part 4. Alcohol and erections. Alcohol is tricky. A small amount may relax you and reduce anxiety, but chronic or heavy drinking does the opposite. Mechanisms of damage. Neuropathy. Long-term alcohol use can directly damage peripheral nerves, including those involved in erections. Hormone imbalance. Liver damage from alcohol abuse can increase estrogen and decrease testosterone. Vascular issues. Alcohol can weaken heart function and blood vessel health. Psychological impact. Increased risk of depression and performance anxiety. Bar chart study spotlight. The Massachusetts male aging study found that 60 to 70% of men with chronic alcohol abuse experience erectile dysfunction. Part 5. Prevention strategies. What a urologist recommends. If you're in the danger zone, here's how to act now before the damage becomes irreversible. Manage cholesterol. Get annual checkups. Eat a diet rich in fiber and omega-3s, and consider statins if prescribed. Quit smoking. Nicotine patches, prescription medications like varenicline, and behavioral programs can double your success rate. Limit alcohol. Aim for no more than 1 to 2 drinks per day, and avoid binge drinking altogether. Exercise regularly. 30 minutes of brisk walking or resistance training daily boosts nitric oxide and testosterone. Prioritize sleep. Poor sleep lowers testosterone and raises stress hormones. Reduce stress. Meditation, breathing exercises, or therapy can help improve hormonal and vascular function. Part 6. Treatment options. If prevention isn't enough or you're already experiencing symptoms, here are evidence-based treatments. PDE5 inhibitors, Viagra, Cialis. Enhance the nitric oxide pathway. Effective in 60 to 80% of cases. Testosterone therapy, only if blood tests confirm low levels. Penile injections, alprostadil for men who don't respond to pills. Vacuum erection devices, non-drug option that's safe and effective. Regenerative therapies, shockwave therapy, platelet-rich plasma, PRP, still considered experimental but promising. Psychological counseling, sex therapy, or cognitive behavioral therapy can help when anxiety plays a role. Always consult a qualified urologist before starting treatment, especially if you have underlying heart or liver disease. Part 7. Final advice. If you have high cholesterol, smoke, or drink heavily, and you're starting to notice changes in erection quality, this is your wake-up call. The good news? In many cases, the damage is at least partly reversible if you act early. Here's your 3-step plan. Get checked: blood tests, cholesterol profile, hormone panel, and a vascular assessment. Make lifestyle changes: quit smoking, control cholesterol, drink less, move more. Use the right treatments, don't self-medicate. Get a tailored plan from a specialist. Your sexual health is not just about the bedroom, it's a mirror of your cardiovascular health. Take care of one and you protect the other. References: NIH, Erectile Dysfunction and Cholesterol, 2022. Journal of Sexual Medicine, Smoking and Erectile Dysfunction, 2020. Mayo Clinic, Erectile Dysfunction Causes. Massachusetts Male Aging Study. If you found this video helpful, don't forget to like, subscribe, and hit the bell icon so you never miss an update. We've got plenty more real talk on men's health coming your way. Thanks for watching, and we'll see you in the next video.